Welcome, Dr. Jeremy Andrews here, Doctor of Chiropractic. I'm coming at you from West Chiropractic in West Byfleet, and today we're going to talk to you about how you can tell the difference between kidney pain and back pain. It is a very common question that we get here in the clinic. People are often wondering if it's just their kidneys that are flaring up and they don't actually have any back pain at all. Or is a back pain more significant of something else that's going on in the rest of the body? Well, firstly, we need to talk about referred pain. So what is referred pain and how does it happen throughout our body? One of the most common types of referred pain is actually sciatica. So referred pain is where you get pain in a different part of your body and its origin is in a different part of the body there. So let me give you an example. If I've got pain in my finger here, and we're saying that the pain is here, well, if the pain is coming from a nerve further up my elbow that's being trapped, that'll be a referred pain coming all the way down my arm. The same is true of sciatica. So sciatica starts in the base of the spine. It's where the sciatic nerve actually gets trapped by either a disc prolapse, by a tight muscle, particularly the piriformis, or some sort of rotation or instability in the lumbar spine. The nerve is compressed or trapped, that then puts pressure on the leg, usually the back of the leg, that can go all the way down to the foot. It can be very painful in the leg, causing sharp shooting pain. This would be a referred pain from the back. So, is kidney pain a referred pain? Is lower back pain a referred pain from the kidneys? Well, let's talk further about this as we go into more detail. So the nerves in the base of the spine are really important. They obviously supply the kidneys, they supply your digestive tract, they supply the rest of your colon, and also your stomach and your liver, and obviously the rest of the legs as well, and your bladder. So it's really important that we have these nerves in the best position and everything functioning as well as we can. So with regards to the kidneys, the nerves that exit around beneath the ribs, those are the ones that go to the kidneys. So it's very, very often that we do get referred pain from there, which can cause problems in that area. The other area you may get some referred pain is we often get clients saying, well, I've got pain in the lower back, but I'm also getting digestive issues. Well, this can often be a knock-on effect from the lower back as well as a referred pain. So it's really important that we look closer into that. It may also be that you do have a digestive issue. So I'd always say, go to see a GP. If you think you're concerned about that, get some tests done. They'll be able to do some blood tests and find out if there is a digestive issue as well as having a structural issue in the lower back. But we can obviously help with the structural issue in the lower back. So with regards to the kidneys are no joke. It's really important that we look after them, and it's really important that we make sure that if there is an issue with them, that we're making every precaution in order to keep them in the best health. So what would be the difference between kidney pain and back pain? With your back pain, it's very often described as a low-level dull ache that just keeps on going on and on and on. Now, we would see this in someone who's been suffering with lower back pain for more than 2 years. Often we see people coming in here with back pain that's been going on for 10, 20, sometimes even 30 or more years. And they say it goes like this. You get good days, you get bad days, good weeks, bad weeks, maybe even months it's been okay, and then it suddenly comes back. This is often characterized by an extreme flare-up, doing something they normally do every single day, like picking up something off the floor, washing the car, picking up the kids, something they do every single day, and the back just goes, it locks into spasm. This will be very, very excruciating. It'll often be a sharp pain across the base of the spine. It can refer down the legs as well. And then other than that, it's usually, once everything settles down, it's usually a low-level dull ache that's just kind of nagging away in the background there the whole time and causing problems. So it's really important we try and distinguish between this and then your kidney pain. Your kidney pain is twofold as well. This is where it can get a little bit confusing. So kidney pain can be a low-level dull ache, but it often can be characterized by, again, a sharp burning if there's any sort of infection in the kidney. So that's where we need to be really, really careful. So there are a few things which distinguishes the kidney pain. It's often higher up around the base of the ribs, not going so far down as above the buttocks in that area. So that's one way that can be distinguished. The second way is having urinary symptoms. So what we mean by that is an increase in urination or having any sort of blood in the urine. If you have blood in the urine, then it's typically not going to be just a lower back issue. There's probably going to be something going on with the kidneys as well. The third thing is it can often be associated with an increase in temperature, body temperature that is. So anything above 37 degrees, you'll be thinking, is there something going on with the kidneys that we need to be looking at there as well? And then the fourth one, or most important one, is that kidney pain doesn't necessarily go away on movement. So it's very difficult to find a comfy position in order to make sure that the kidney pain is going away. So with lower back pain, it's often we can find a comfy position, maybe lying on our side or extending back or bending over. That can often take pressure off the back and would lead us into more of a lower back mechanical issue rather than out and out kidney pain. Okay, so as you know, I'm a chiropractor, so I'm not a medical doctor and I don't have experience of dealing with kidney pain. All I can help you with is, well, it's true lower back pain. So if you are suffering with any of these symptoms, I would always advise going to see your GP. If it's severe and you're worried about things like blood in the urine or a very acute or sharp pain in your kidneys, then it's best to go and see a GP. But you can start doing these simple tests. So if you're finding that it's not painful when you're moving, then it's probably more likely going to be a lower back pain. It's going to reassure you in that respect. If you're finding that the pain is a little bit lower down, it's across the buttocks, then again, we're probably thinking, okay, more lower back pain here. Anything around the base of the ribs. If I show you here, on me, so you've got like the buttocks here, and then you've got lower back here. That'll be more, lower ribs. That would be more thinking, okay, this could be a kidney issue around there. We often get problems, we call it the TL junction, it's the thoracolumbar junction. So it's essentially where the lumbar spine, the lower spine, meets the thoracic spine. So there's a curve that transitions like this, and it's an area that builds up a lot of stress. It's a junction. So think of spaghetti junction, lots of traffic, lots of stress, lots of build up in those areas. But you often don't get pain in those areas. It's just somewhere that we like to release because it relieves a lot of pressure around the lower back. So often when we've seen people with kidney issues, when we adjust those areas, we would often expect the lower back to feel a lot better afterwards. And if it doesn't, and there's other kidney symptoms we're a bit wary of, we would often refer out to a GP to say, look, we think there might be some kidney issues going on here. We're a bit concerned. Would you be able to check that before we carry on with any further care? So the test that I would do would be the movement test, and also checking your urine, and then also checking your temperature as well. Other than that, I think you'd be okay with your lower back pain. And then it's really important to work on your lower back issues to make sure that we're getting those nice and stable going forwards. Okay, so as ever, if you like the videos, please subscribe to these. And also there's a link below to download a copy of our free book. And we also mail that copy out to you if you're within this country. So please let us know and we'll get a free copy out of the post. We cover the postage and packaging for you. It's down in the comments box below, so you can hit that. Please subscribe and like, and we'll catch you on the next one. Thanks a lot.